Tell me about your life and your pain before the surgery.
Well, prior to surgery, I was having extreme pain in my lower back. Standing, it was something that came on gradually, and as time went on, it became more and more aggressive, and as far as how much pain it was. And it got to the point where even standing was something that was almost impossible. I would stand and, like when you feel the house shake when a big truck drives by. When I stood, my legs would shake so badly that it felt the house would vibrate like that.
Because you were unsteady on your feet because of the pain.
Very unsteady.
What did you observe? What could he do? What could he not do?
He was moaning and groaning during sleep. It intensified January-ish. It was getting pretty bad.
But it was
but January, February, it got terrible. And it got so that actually the month before surgery, I ended up being laid off from work February 17th, and it's a good thing because I ended up staying with him pretty much downstairs for safety.
How was walking before the surgery?
Walking was next to impossible.
I remember in the day of the surgery, before the surgery, you could barely walk.
Correct.
Correct.
And standing. Even sitting
Yeah.
for any extended period of time. The only relief I would get is if I laid down, and then of course you become stiff laying in one position and then trying to move to another position, even sleeping in bed.
And that's something like that when you don't walk as well, your heart or lung, all the conditions as well. So it's it's a very important thing for us to ambulate.
Yeah, and he's so deconditioned, but not only that, he literally, I would send a text to my good friend and our pastor to ask for prayer immediately. He would sob uncontrollably and say, "Dear God, just take me now."
And
it was, his depression was
and
scarily increasing.
And I have myself back pain, so I know what you have been going through. The surgery wasn't even a month ago. When was it?
March 18th.
We fixed
March 18th.
We fixed the bottom two discs. We put two spacers. We opened up the space where the nerves are passing through here and here, put 6 screws, and this is the record of the surgery. Our surgery my part was only 52 minutes. We stayed just one night in the hospital. Our blood loss was 60 cc, and practically we fixed the problem in a surgery that my part was less than an hour. Now, you told me you walked right in the PACU, not even up to the floor. Tell me.
They had asked me there in the recovery room to see if I could stand up out of the bed and walk and see how far I could walk, and then turn around and walk back. And I'm like, and they gave me the assistance of a walker. And in that PACU, I walked from my bed to the nurse's station, which was approximately maybe 10, 12 feet away, and turned around and walked back unassisted.
How long after the surgery was it?
An hour.
I was literally still in recovery.
He was in the recovery room.
Did you watch him?
No, because he was in recovery. I didn't see. I do
upstairs.
know the physical therapist said she just couldn't believe. He sent everybody in shock. Nurses, everybody that was there in shock
they were in awe that I was able to get up and do that.
And the reason that you could do that is because we didn't have to massacre your back, completely destroy all the muscle and the bone to get the job done.
With the 3 previous surgeries I had had before, you can tell them, and you could verify that they had went right through the same incision all 3 times, and so the muscle strength back there was non-existent, and the scarring tissue was really bad, as you had stated and observed before.
1 to 10, how bad is your pain now?
Right now, as I'm sitting here, it's been a while since I've had my pain medication, but I'd say I'm at the pain level of about a 4 to 5 out of
4 to
10.
5. So still much better than it was before the surgery.
Prior to surgery, it was
the pain scale didn't go high enough,
and it was constant. It never went away.
And we are only 3.5 after the surgery. We have a long way to go, but this is the best we can achieve. Everything is perfect. Every screw is in exactly where it needs to be. And again, we did it with multiple small incisions. We didn't have to fillet you open to get the surgery done. And people just recover much faster. And this is almost like every time I sit in an airplane, I'm surprised that big thing can fly. And every time I see a patient in your situation, even though I'm doing it, I'm surprised how well patients do comparing to open old-fashioned surgery. That is almost like, for me, even after 10 years doing this, almost like a medical miracle.
Yes.
How fast we can get people on their feet, send them back to their lives.
And that's huge for healing.
Yeah. Well, thank you so much for the interview. Any other question or comment on the, no?
No, other than you're the only one to go to.
No, thank you. I appreciate that. Really
Honest to
appreciate that.
goodness,
Yes.
you've helped my mom, you've helped my dad, you've helped Paul,
Yeah.
you've helped friends of ours.
Thank
Yes,
you. Thank you. I
absolutely.
appreciate that. I really appreciate that.